We're back with McCawley Periodontics. The last time we were here, we talked about gum disease, and today we're going to talk about implants. Isn't that correct?
Mm-hmm. Yeah, so today we're going to talk about dental implants.
Okay.
So this is probably the best way to replace your teeth. So a lot of people are asking right now, what is a dental implant? It's actually a titanium screw that goes into your bone right there. It replaces these roots right here. So instead of roots, when you lose a tooth, you obviously don't have anything here. We were able to place an implant, replace that tooth, and get it so you can chew. Basically, it looks nice and it's good for function as well. Looking up here, we actually have somebody who lost most of their teeth. I think they had maybe 4 teeth remaining right there, and we were able to actually replace all of their teeth. This patient, because it was a full arch case, he was able to get his teeth a temporary set the next day. And that's something that's nice to be able to do. He went from this to having teeth the following day.
And this is an improvement to the quality of life of the patient because they're able to chew better, they're able to have a tooth where there wasn't one. It could be aesthetic purposes.
Oh yeah, no, this is a complete quality of life change because again, you've got people walking around like this guy. He was missing most of his teeth. He just had 4 teeth right there, and they didn't look very good. So it's something where you can go from basically not being able to eat anything but applesauce to being able to eat a full apple, bite into it and everything.
And what sets you apart from other places that are doing implants?
Well, the thing is, we are a specialty practice. I went to Nova Southeastern University. I got trained there in a 3-year residency, whereas a lot of guys, they end up taking a weekend course and they come in and they think, you know, they can place implants. Maybe you can, but is it a great idea? Sometimes not.
So what is the goal of getting an implant?
Well, the goal is to replace your teeth. For someone who's losing their teeth or they've already lost them, it's to get the most natural and the best function you can get out of your teeth. So you can eat and you can be happy and healthy with them. So here's kind of an example. So here's a patient that actually ended up walking in like this. You can see the teeth, they're dangling in the air right there. Those aren't gonna last much longer. So what we were able to do is we were actually able to replace these teeth with these. And these are actually only the temporaries. And this is only a couple days later we took that photo.
These are a couple days apart.
These are a couple days apart.
Is incredible.
So you can see, you can go from not being able to eat anything to being able to eat naturally in only a couple days.
Well, doctor, thank you so much for your time. Hopefully no one is at this point, but if they're anywhere in between, that you can get them right back here.
That's what we're here for. Thank you.